Hi everyone, today I am going to discuss in this video presentation one neurological disorder. This is the Creutzfeldt Jakob disease and variant Creutzfeldt Jakob disease. Let us start knowing what CJD and diseasevCJD is. Creutzfeldt Jakob disease belongs to a group of degenerative infectious neurologic disorders called transmissible spongiform encephalopathies. Very rare and has no identifiable cause. While diseasevCJD is the human variation, bovine spongiform encephalopathy results from the ingestion by humans of prions in infected beef. Prions is proteinaceous particles that are smaller than a virus and are resistant to standard methods of sterilization. We have here an illustration of what a normal prion and an abnormal prion work like. The difference of these two prions are the amino acids in beta helix. CJD and diseasevCJD have distinct clinical features. One characteristic that share is lack of CNS inflammation. CJD lie dormant for decades before causing neurological degeneration. diseasevCJD less than 10 years. Both the symptoms are progressing. There is no definite treatment and the outcome is fatal. Now, let us explore its pathophysiology. Prion crosses the blood-brain barrier and is deposited in brain tissue. Prion causes degeneration of brain tissue. Cell death occurs. Spongy vacuoles are produced in the brain. Spongiform changes. In diseasevCJD, the spongiform vacuoles are surrounded by amyloid plaque. Incidence: 90% or 1 per 1 million people sporadically. 5% of the sporadic cases results from contaminated neurosurgical instruments, cadaver-derived growth factor, corneal transplants. 10% of cases familial. Mode of transmission was linked to the ingestion of beef contaminated with neurologic tissue. The prion exists in lymphoid tissue and blood in both CJD and diseasevCJD. No method is available to screen blood for infectivity. For its clinical manifestation, let us compare the two. In CJD, psychiatric symptoms occurs late, while in diseasevCJD, psychiatric symptoms occurs early. In CJD, the mean onset is 50 years, while in diseasevCJD, the mean onset is 27 years. In CJD, there is memory loss, involuntary movement, paralysis, mutism, while in diseasevCJD, there is affective symptoms, sensory disturbance, limb pain, muscle spasm and rigidity, dysarthria, incoordination, cognitive impairment, and sleep disturbance. After the onset of symptoms, the patient survives an average of 14 months in CJD, while in diseasevCJD, the patient survives 6 months after onset of symptoms. The assessment and diagnostic findings for these diseases are: for CJD, we have brain biopsy that is used to diagnose CJD. The immunological assessment of CSF detects a protein kinase inhibitor called 1433. The presence of this inhibitor indicates neuronal cell death, which is not specific to CJD but does support the diagnosis. The electroencephalogram reveals a characteristic pattern over the duration of the disease. After initial slowing, the EEG shows periodic activity. Later in the course of the disease, the EEG shows burst suppressions characterized by periodic spikes alternating with slow periods. The MRI scan demonstrates symmetric or unilateral hyperintense signals arising from patients with VCJD do not demonstrate EEG or CSF changes, and the MRI scan shows bilateral hyperintensity of the posterior thalamus. The prion associated with VCJD has been shown to accumulate in the tonsils and other lymphoreticular tissues. Therefore, tonsillar biopsy may be used in the diagnosis of VCJD. Medical management. After the onset of specific neurologic symptoms, progression of disease occurs quickly. There is no effective treatment for CJD or VCJD. The care of the patient is supportive and palliative. Goals of care include prevention of injury related to immobility and dementia, promotion of patient comfort, and provision of support and education for the family. Nursing management, supportive and palliative, psychological and emotional support of the patient and family throughout the course of the illness. Hospice care, prevention of disease transmission, standard precautions, and stringent sterilization methods. For viewing our video, I hope you learn a lot. Good day.
Pop Dentology.
I say I'm too late.